Let's now proceed to diagnosis according to Zhangfu organ patterns with pathology of liver imbalances. Anger in all its forms affects the liver, and when the liver is imbalanced, it often manifests with the person being irascible and easily angered. Anger is extremely yang in nature. It rises to the head and is explosive. People with liver excess imbalances can have a short fuse and be bad-tempered. When there is liver chi stagnation, the person can internalize their anger and frustration for a long time. When they do finally release their anger, it is often the wrong people who bear the brunt. The more heat that there is, the more irritable the person will be and the shorter their fuse. Due to its ascendant dynamic, anger can aggravate or trigger symptoms that are manifestations of ascending liver yang or liver fire. This will typically be things like headaches, pain behind or in the eyes, tinnitus, and vertigo. Stagnation of liver qi can also manifest with the person being irascible or bad-tempered. When there is liver qi stagnation, the person will easily feel frustrated and they will often be impatient. There will be frequently mood swings, and when the liver qi is not flowing freely and unhindered as it should do when the liver is harmonious. If the hun is blocked, as can be the case when there is liver qi stagnation or liver blood stagnation, or if the hun lacks nourishment, such as when there is liver yin deficiency or liver blood deficiency, it can result in depression, with the person having difficulty seeing a future for themselves. This can be seen in the eyes. It is as if they do not look outwards and instead their vision is turned inwards. This is because liver stagnation prevents the hun from being able to exit and enter freely. At night, the hun returns to the liver. If the hun is not anchored by liver yin and liver blood or is agitated by heat, it will create visions or dreams. A person mainly dreams in rapid eye movement sleep. In REM sleep, the hun is active, which can be seen in the characteristic rapid movements of the eyes whilst the person is sleeping. When the hun is not anchored by liver blood, the person can dream a lot and suffer from insomnia. If there is heat in the liver, it will agitate the hun at night and the person will sleep restlessly. They will have many and sometimes violent dreams or nightmares. Heat in the liver, particularly heat from liver chi stagnation, can cause the person to wake early and have difficulty falling asleep again. The sound in the voice that is manifestation of the liver is shouting, which can be heard when a person is angry. This can also be a more permanent quality in some people's voices. The harshness will not be as extreme as when a person is angry, but there will be a slight hardness and resonance in the voice. This will usually indicate an excess pattern of imbalance in the liver. If there is liver chi stagnation, the person can have a staccato voice that sounds a bit like a machine gun. This type of voices, through the combination of the hardness in the voice that is characteristic of liver excess imbalances and the unevenness and juddering that is the result of liver chi not flowing freely. When there are deficiency conditions in the liver, the voice will lack the shouting quality, it will be too soft and lack cloud. This will be especially noticeable in situations where the person is angry or when the voice is raised. Liver excess imbalances will often manifest with symptoms and signs in the liver's partner channel, the gallbladder channel. In these cases, the symptoms and signs will typically be hemilateral. Migraines or throbbing headaches are a typical example of this. Another characteristic of liver excess symptoms is that they are triggered or aggravated by stress, anger, frustration, and similar emotions, influences, and often manifest in the premenstrual period in women. Thank you for your attention.